there are some unanswered questions in the wake of the Pacific trial. It gave 2 cycles of chemotherapy concurrent with chest radiation, or at least 2 cycles. And then patients went right on to durvalumab. About 20 to 25% received induction chemotherapy before starting that. But additional consolidation chemotherapy was not included. I would not be inclined to give chemotherapy after durvalumab, which was given for a year duration in the Pacific trial. The question is whether, particularly I would say for the patients who are getting carbo and paclitaxel on a weekly basis, whether we might want to give additional what we might consider systemic dose, because there is some question of whether the weekly carbo paclitaxel regimen for 6 or 7 weeks is sufficient to address micrometastatic disease systemically. That's an open question. And I would consider now for my patients who are only getting 6 or 7 weeks of carbo paclitaxel weekly without any consolidation chemo, I would consider doing it in an induction approach, which also certainly makes it easier to organize, because one of the challenges in treating patients with locally advanced disease is that you need to coordinate with the radiation oncologist and get the simulation done. It often takes a few weeks. And one advantage of doing an induction approach, which hasn't shown a significant improvement historically, but shows trends of a favorable benefit, could be that you can give it for a couple of cycles, get a good systemic dose of, say, every 3-week carbo and paclitaxel, and then go on to the chemo and radiation with a possibly smaller radiation field, and giving the radiation oncologist enough lead time to really get things folded in a controlled way, rather than scrambling at the beginning to get everything started, as it often is the case. I would say that we surmise that it's particularly valuable to give the durvalumab in quick succession after completion of the radiation. It was done within 6 weeks of completion of the radiation course, and in some cases within a couple of weeks. And so I would not be inclined to postpone the durvalumab by interposing consolidation chemotherapy for 2 cycles or a few months before starting durvalumab. So I wouldn't do it as a consolidation before or after durvalumab given for a year, but I would consider it for induction, particularly though for the patients who are getting weekly carbo and paclitaxel alone. The Pacific trial evaluated patients within the first few weeks after they completed chemo and radiation and had them start durvalumab within 6 weeks of having completed radiation. So some of the patients, a minority, had received it just within the first couple of weeks after chemo and radiation, but the majority were somewhere within 2 to 6 weeks out. In my practice, and I think many other thoracic oncology specialists, tend to not do repeat imaging in the first week or 2 after the radiation has been completed, because we expect to see further shrinkage of the cancer for several weeks out from the radiation and chemo. So historically, we might have done this 3 to 4 weeks out. I might move that up to 2 to 3 weeks and have them start the durvalumab in short order after that. So I will typically have them start 3 or 4 weeks out. You could do it a little earlier, you could do it later. I would also say that if, for some practical reasons, they couldn't start until they're 6.5 or 7 weeks out, it would not dissuade me. But the trial had them start within 6 weeks. It is given every 2 weeks IV for a year, and that's what the FDA approval is for. We don't know whether treatment beyond a year is beneficial. The trial didn't ask that. We will need to see the longitudinal results and whether the benefits of giving it for a year are sustained, long-lasting well beyond that, or time-limited, and might suggest that there would be a benefit to continuing it. But the FDA approval and the way the trial was conducted was start within 6 weeks after the radiation is completed and give every 2 weeks for up to a year.